Yeah, I'm Dr. Vikram Hude, Director Intervention Neurology, Narayana Health, Head of Neurology. Today is a milestone event for us. Neurological conditions, there are various procedures available. Many people don't know about it, that in neurological conditions there are many treatments available and it can be prevented also. So we have crossed 1 lakh neurological procedures. It includes various procedures like DBS, interventions, headache interventions, EG, NMG, everything. And I want public to know that few of the neurological conditions, for example, brain stroke, can be prevented and it can be treated also. Yeah, so main challenges is people don't identify the symptoms. Okay, so that is the main thing. And even because it is a painless condition, they neglect it, and they don't know that it's an emergency, they need to reach a stroke ready hospital, and the treatment can be given in some cases up to 24 hours time window. So this is the main hurdle. Reaching the hospital, calling the ambulance, identifying the symptoms. These are the main hurdles in India now. All over India, mechanical thrombectomy, what is required is around 3 lakh procedures, but we are doing only 5,000 procedures all over India every year. All over India, I'm telling. So more awareness is required that neurological conditions are treatable, especially stroke, epilepsy, movement disorder, many things. And we need to identify early and reach a right hospital early. So to remember, you should know the mnemonic B fast. B is balance, if they're having balance issue or anything. E for eye vision, either blurred vision or double vision. F for facial asymmetry, like one side of the face goes one side. Arm weakness, A for arm weakness, means if you ask them to lift both hands, one hand will go down. S for speech disturbance, either they stop speaking suddenly or they will have slurring of speech. T is time to rush to stroke ready hospital.
So I would like to highlight on one of the most underutilized treatment in neurology, which is deep brain stimulation. So this is a procedure which is done for a lot of neurological disorders like Parkinson's disease, tremor disorders, and disease which involve twisting in multiple parts of the body called dystonia. So the awareness about availability of this procedure is very minimal. It requires a lot of awareness creating attempts from doctors as well as from the press also, that such procedures are available, and the patients who have these conditions like Parkinson's disease, tremor disorders, dystonic disorders, these all patients, they're going to benefit a lot if they undergo these procedures called deep brain stimulation. So I think it is a very, very underutilized procedure. More and more awareness is required here so that patients can benefit from this.
It's a milestone for the Department of Neurology today, as we have crossed 1 lakh procedures. The procedures mostly that we have covered the stroke interventions, deep brain stimulation, management of complex epilepsy patients, EEG, video EEG, pre-surgical evaluation for epilepsy, and surgical treatment for epilepsy. Epilepsy is a common condition. It's actually a disorder of the brain where a person gets recurrent episodes of unprovoked seizure. In India, roughly about 1.2 crore persons with epilepsy we have, and nearly about 7 to 8 lakhs epilepsy patients they get added up every year. Now the most important thing to note that in India, nearly 30 to 50% of the patients, they do not receive proper treatment. That is called treatment gap, and that is more common in rural area as compared to the urban area. Now that is mainly due to the educational gap and the stigma related to the epilepsy. But the good news is that nearly 70 to 80% of the persons with epilepsy, they can be cured by proper medications alone. Nearly 20 to 30% of persons with epilepsy, their epilepsy may not be cured by medications. In these situations, there are other treatment options are available. For example, epilepsy surgery, neuromodulation treatment like vagus nerve stimulation or ketogenic diet, or other forms of immunotherapy. So the most important message that we would like to give today is that epilepsy is treatable. Most important thing is that the awareness should be there so that the people should reach to the hospital to receive the proper treatment. Epilepsy is treatable. Nearly 70 to 80% of cases it can be treated by medications, and nearly in 20% of cases it can be treated by other forms of treatment like epilepsy surgery. Thank you.